Well, hello there. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwood, Buchanan. And today I want to discuss a new treatment for peripheral neuropathy. Peripheral neuropathy results in damaged nerves. In the case of chemotherapy, typically from the toxins they use to kill the cancer, but also kill off the nerves or die off the nerves for you. Same thing with diabetics, except for diabetics, what you have is more the high sugar uh, messes up the nerves pretty bad. The nerves start to die over a period of time. It's not a quick thing, but it does happen over prolonged periods of time. I do find that the people who are post chemotherapy and are healthy do pretty well. The diabetic neuropathy cases take a little bit longer to see results because diabetes is a much more long-term issue. So having said that, let's get the name out there. Transcutaneous Pulsed Radio Frequency. And what exactly is transcutaneous pulse radio frequency? Well, if you've ever heard of the process called ablation, ablation is where the doctor will burn off the nerve and stop the problem that way. But you lose the nerve and its functionality and the way the nerves communicate with the brain to the body part. So if you're that bad off, sometimes an actual ablation where you kill the nerve is maybe the best way to deal with it. But if you want an alternative, that's where transcutaneous pulse radio frequency comes into play. And basically, it's kind of a non-invasive evolution of traditional ablation. So regular ablation uses heat to destroy tissue. Pulse radio frequency delivers short bursts of high-frequency energy, followed by quiet periods that allow the heat to dissipate, keeping the temperature to about 107 degrees. The temperature is high enough to alter nerve signaling, but low enough to avoid damaging the nerve's physical structure, making it useful to help people with neuropathy get their lives back. So how does transcutaneous pulse radio frequency work on diabetic or chemotherapy damaged nerves? Well, the exposure to the toxins for chemotherapy or the prolonged blood sugar issues causes oxidative stress and inflammation, which leads to misfiring of the nerves and send constant pain signals to the brain. Okay? So the way that this particular treatment works is rather than killing the nerve, it acts more like a biological regulator. So there's an electromagnetic field created by the pulses, alters the gene expression within the nerve cells. It targets specifically what's called C fiber, which is a highly myelinated fiber that sends a lot of pain signals up to the brain. And then you have to worry about the descending signals that come down. And this is where we can help inhibit it. So you have with neuropathies of both sorts, and we're really going to stick with chemo neuropathy and diabetic neuropathy. The studies show that the downregulation of pro-inflammatory markers like interleukin-6, tuberculin factor alpha, reduce the activity of the microglia, which are the immune cells in the spinal cord that can amplify pain signals. So if you reduce those, and you can it helps limit the cytokine production. Cytokines are the storm of inflammation that occur naturally, and in small doses they're very helpful. In prolonged exposure, they're not. And what it does is it affects the immune cells in the spinal cord that effectively amplify the pain signals. So if you can limit that, that's one way of bringing the pain level down. Another thing too is when you have damaged nerves, we have what's called unstable resting membrane potential. That means the nerves are hyperexcitable and fire at the slightest provocation. So the transcutaneous pulse radio frequency therapy helps stabilize these membranes, and it raises the threshold required for the nerve to send pain impulses. So that's a pretty big thing here. You're trying to mitigate the issue, not where you have the nerve, but at the spinal cord and up to the brain. Very, very effective in doses. So, a lot of times people are going to take, Lyrica gabapentin, and it dulls the entire nerve system. This is non-invasive, and results can be seen as little as 4 to 6 weeks of twice a week treatment. So can be very effective as a way to really mitigate diabetic and chemotherapy neuropathies. Now, I was really hoping not to get too technical, okay? So when you have a neuropathy, the brain just doesn't just receive pain impulses, it also becomes sensitized to it. So the more sensitized it becomes, it kind of clogs up the brain with these pain signals that don't go down. So pain signals from the feet of the hands travel up to the spinal cord, a space in the brain called the thalamus. And this is like the brain's switchboard. From here, these pain signals are distributed to several different areas, which are collectively known as the pain matrix. And so somatosensory cortex is up, like if you put your hands on top of your head, right about there. This is where you can pinpoint the location, intensity, the burning, tingling, all the sensations that go along with neuropathies. Now, another spot in the pain matrix is called the anterior cingulate cortex. This processes the emotional distress and the unpleasantness of this pain. There's so many different centers of the brain that receive and interpret pain, which then sends the signals back down. When you can mitigate it at this higher level, because of the pulse radio frequency, say that 3 times fast, the transcutaneous pulse radio frequency. So another area we have to work with is the insular cortex. This helps the brain evaluate the internal state of the body and provides the feeling of pain. So there's a synaptic where the two nerves come together, is called a synapse. And the body has a built-in volume knob for pain control. It's called a descending inhibitory pain pathway. When the brain decides to suppress pain, it sends these downward, what we call efferent signals, from a place called the periaqueductal gray area in the midbrain down to the rostral ventromedial medulla, and finally back to the spinal cord. This pathway works like a gatekeeper. If the gate in the spinal cord is closed by these descending signals, the pain message from your nerves never reaches your conscious brain. So I know I'm inundating you with all the stuff here, but you got to block the pain at a higher level where your brain is assessing the nerve damage. Think about it. You're going to change the way the brain works using this particular therapy. So what's good about it? It's non-invasive. And also, too, it works pretty quickly because most of the treatments are not something that's going to be covered by Medicare or insurance. That's one thing. The question is, how valuable is quality of life to you? If your life is inhibited because of neuropathy, what is it worth to you to get your life back on track? Now, I'm going to go into a little bit more. We'll talk about the neurotransmitters that are helped. So stay put. So I'm going to try to spare you more of the technical stuff, but let's go into the key neurotransmitters involved. So you want to inhibit neuropathic pain. It relies on a couple different neurotransmitters. Serotonin, which acts in the spinal cord to inhibit transmission of pain signals. Very important if you want to stay out of pain. All right, norepinephrine. This is a really important way because the norepinephrine works in the spinal cord to block the release of pain chemicals from peripheral nerves. So this is huge, but all of these are important as well. You've heard of endorphins, like if a cyclist is going 100 miles on a bike ride or a runner is going on an extended run, the natural painkillers kick in. Now, the next one, too, is as far as the neurotransmitters would be GABA. And GABA is like a brake on the nervous system. When you can break the nervous system, you can, again, further inhibit pain. Listen, I'm not saying I'm going to cure neuropathy. What I'm saying is, with this particular treatment, you have the ability to inhibit the pain and get on with your life. Pretty important. What do you think? So try to think of chronic. I usually like to use the analogy of, when we were kids or when I was a kid, if you left the phone off the hook, you could hear it out in the garage, out in the backyard until you put the phone back on the hook. Well, in chemotherapy patients, diabetic patients, the inhibitory system we've been talking about is worn out because of the constant bombardment of pain signals. And that's why, like certain medications, they're just going to work for the short term. they don't really get they don't inhibit pain. They just shut down the whole system. Most of these medications, the Lyrica, Cymbalta, gabapentin, are more like, they're primarily anti-seizure medications. So they're going to shut down things, and that will only work for the short term. So the idea here is to understand that pain can be mitigated on a higher level without damaging the nerves further, as you would do with ablation. So we all have we used to have radios in our cars, I guess. Now we sure we have radios now. We have Spotify. So the transcutaneous pulse radio frequency acts like a neurological tuner for a worn-out pain gatekeeping system. All right? So the constant intense pain signals bombard the spinal cord and eventually exhaust the brain's descending, which is the downward inhibitory pathway. So the braking system runs out of the neurotransmitters it needs to function and leaves the pain gate wide open, making the problem more and more chronic as it goes along. So here's how the braking system, the natural braking system should work. All right, so let's get a little more technical again. I apologize. So you have to understand the nerve information traveling upward to the brain, okay? So what the transcutaneous pulse radio frequency treatment does, it's the electrical fields stimulate the damaged peripheral nerves to send a control, non-painful signal up to the spinal cord, to the brainstem, and this acts as a wake-up call and alerts the brain to reactivate the descending inhibitory pathways that have previously given up. So it's like a second chance. You didn't get your homework in on time. Now you can, and you can get the grade you deserve if you're a student. All right, now let's go over how transcutaneous pulse radio frequency helps those neurotransmitters. It's very important. So it increases norepinephrine. It stimulates the locus coeruleus, which is another section of the brain, and it induces the locus coeruleus to dump norepinephrine into the spinal cord of the dorsal horn. And what this does is it clamps down the release of pain chemicals. So it's a much more than a simple, listen, you take a pill, you don't know what it's going to do. I'm telling you what this treatment can do for you if you're in chronic issues or chronic pain because of neuropathy. It also restores the serotonin balance, and this is required to operate the pain gate. When you have this working properly, you can have less pain. All right, so I mentioned GABA before, another neurotransmitter. So when you have chronic issues like neuropathy, GABA is heavily depleted. And so the nerves lose their natural ability to quiet themselves down. The electromagnetic field generated by the transcutaneous pulse radio frequency helps restore expression of GABA receptors and stimulates the GABA into neurons. This can provide immediate localized braking effect right at the root where the peripheral nerve enters the spinal cord, preventing the misfires from traveling up to the thalamus, which is that relay system we mentioned earlier. Now, hitting you with another technical term, it's called central sensitization. Central sensitization. So when the brakes fail for a long period of time, the brain undergoes what we call central sensitization. It becomes hyper-reactive. So another term is allodynia, where a light touch can feel like a knife cutting through you. It just becomes way oversensitized. And so what the transcutaneous pulse radio frequency helps reset the thalamus and the somatosensory cortex, lowering the brain's overall hyper alert to the pain signal. Again, I'm hitting you with all this technical stuff. So think of it this way. When you have a mechanical reset for chemical exhaustion, well, medications try to artificially flood the brain with chemicals to force the brakes to work often, but they also cause a lot of side effects: brain fog, weight loss, balance issues. The transcutaneous pulse radio frequency uses electromagnetic energy to stimulate the body's native wiring to produce and utilize those exact neurotransmitters where they are needed to help end your pain. Now, I know it's been painful to listen to me, but I urge you, if you're suffering with chronic pain, let's go outside of diabetic neuropathy and chemo-induced peripheral neuropathy. Chronic pain can and will respond to this particular treatment. what you're doing is you're taking it to the brain. Medications will do it. Listen, medications are going to work in the short term. Then again, medications have their side effects. Would you rather short term, or would you more of a long-term solution to get ahead of your problems and solve it? So I'm going to sign off because this is took a lot of preparation to do this particular podcast. And if you have questions, you can reach out to me, 203-656-3636, 203-656-3636. Thank you very much. I'm Dr. Brian McKay. Have a great day. And again, reach out, 203-656-3636.